They handed the new nurse a blind combat veteran, who hadn't spoken a word in 6 days, and the laughter at the station started before she even picked up the chart. Welcome to Quiet Badge's Stories. If you believe the quietest person in the room is often the one who has already survived the loudest moments, you're in the right place. Hit like, subscribe if you're new, and drop a comment telling me where you're listening from tonight. I want to know how far this one travels. Now, let's get into it. Audrey Laine had been a nurse at Hargrove VA Medical Center for exactly 22 days when Nurse Jackie Drummond slid a patient chart across the desk like it was a dare. She had a way of doing that, sliding things, paperwork, blame, the occasional cruelty dressed up as training. Room 7, Jackie said without looking up. Colonel Dale Souza, retired Army Ranger, lost his right eye to an IED outside Kandahar, traumatic brain injury with light sensitivity, full communication blackout since admission. Hasn't eaten in 2 days, pulled his IV twice. 3 staff members have already requested reassignment off his case. Chad Merritt, the resident, leaned against the wall near the supply closet with his arms crossed. The kind of young doctor who'd learned confidence before competence and was still working on catching up. Should we take bets? He said. Jackie smiled at the counter instead of at Audrey. That meant she wanted distance from the joke while still enjoying it. Dr. Peter Holt stepped out of the physician workroom at exactly the right moment, the way people who enjoy others' discomfort often do. Silver-haired, broad-shouldered, with a handshake and fundraiser quality that made administrators trust him and nurses watch him carefully. He looked at Audrey the way people look at furniture they're deciding whether to keep. Laine, go establish contact. If he's combative, document it and come get me. Audrey took the chart. Dale Souza, 54. Colonel, United States Army, Special Forces, 3 deployments. IED blast, right orbit destroyed. Surgical enucleation, glass prosthetic placed 6 months. Phobia. Admitted after collapse during outpatient physical therapy. Fever, elevated heart rate, refusing all care. Suspected sepsis, workup pending. Down the margin, in capital letters, docile, uncooperative, non-compliant. Audrey hated those words. Not because patients weren't sometimes difficult, but because they were always written about the ones nobody had tried hard enough to understand. She heard Chad say something behind her. Jackie laughed. She kept walking. The corridor smelled like industrial floor cleaner and something underneath it that no amount of cleaning ever fully removed. Old grief, maybe, or just the staleness of a place where people waited for news they were afraid to hear. Veterans lined the hallway in wheelchairs and on benches. A man with no left hand below the wrist read a paperback Western with his remaining one. 2 older men argued in low voices about whether the cafeteria had gotten worse or just stayed consistently terrible. Audrey understood all of them in a way she didn't try to explain to people who hadn't been where she'd been. She stopped outside room 7 and looked through the narrow window. Dale Souza sat up against the headboard with his knees bent, not resting, stationed. His remaining eye, dark brown and very still, tracked the room in a slow, methodical pattern. Door, window, oxygen panel, call button he'd clearly already decided not to use. The blinds were drawn, the overheads off. Someone had taped a note to the wall. Light sensitivity, do not enter with bright light. But it hung crooked, coffee-ringed at one corner, which told Audrey exactly how carefully it had been read by the people coming in and out. An untouched meal tray sat on the overbed table. The IV line lay where he'd disconnected it, not ripped out in anger, but peeled back with intention. He wasn't out of control. He was in complete control of the only things left in the room he could control. Audrey knocked twice on the doorframe, soft but deliberate. Not a visitor's knock, not a nurse's bright "we're coming in" knock, the kind that said, "I know you heard me, and I'm waiting for you to decide." Dale's eye moved to the door. She pushed it open slowly, hands where he could see them, body angled so she wasn't blocking the exit. She'd learned long ago that the fastest way to make someone feel trapped was to stand between them and the door. She didn't reach for the light switch. "My name is Audrey. I'm your nurse tonight. I'm not going to touch you without asking first." He said nothing. His eye didn't leave her. She pulled the chair from the corner and sat down, not beside the bed but across the room, at a normal conversational distance, the way you'd sit across a table instead of looming over someone in a hospital bed. "The note on the wall says lights. I'll leave them off unless you want them." "Nothing." "You pulled your IV. I'm not going to put it back in right now. But I do need to know your pain level before I leave, and I need 1 set of vitals. After that, whatever you want to tell me or not is your call." Still nothing, but his shoulders dropped a 1/4 inch. She caught it. "I noticed the tray. Is it the smell, the food itself, or is eating just not something you want to deal with right now?" His jaw tightened. "All 3. His voice was rough from disuse, the words dragged out like something he had to clear rubble to reach. "Fair. What would you actually eat if it was in front of you right now?" He studied her, like he was hunting for the trap in the question. Black coffee, real food, not whatever that is. I can do black coffee. Real food is harder, not impossible. Would you let me take your blood pressure and temperature while I figure it out? You're not going to tell me to calm down? No. Or tell me the staff is just trying to help? No. He held out his arm. Blood pressure 161/96, pulse 118, temperature 101.2. His right lung sounded coarser than it should. His abdomen was tight when she asked to check, and the way he held his breath on the right side told her exactly where the pain lived. She wrote it all down without letting anything show on her face. He watched her write. You move like someone who's been on a forward operating base, he said. She capped her pen. I move like a nurse. Lie. She looked at him. You keep the door at your 10 o'clock. You checked the oxygen panel before the call button. You sat down before you introduced yourself, because standing over a patient in a defensive crouch reads as threat assessment to someone with combat training. No civilian nurse learns that. They learn proximity and presence. You learn distance and patience. Audrey set the cuff on the table. Your right lower lung sounds are diminished. Your fever's 101.2 and climbing. Your abdomen is rigid on the right side. I need a physician in here to order imaging, and I need it in the next 20 minutes. What aren't you telling me? That I think something's wrong beyond the infection markers we already have, and that your doctor's going to push back, and I'm going to push harder. She stood. I'm getting you coffee first. She was almost to the door when he spoke again. Ghost, he said quietly. She stopped. Army had a unit attached to a forward medical element in Ghazni province, 2011. Small team, no official record. They called the medic Ghost. She went places nobody else could go and came back with people nobody thought were coming back. Audrey turned around slowly. You need that imaging, she said. His eye was very steady. What happened to Ghost? She got out. She looked at the door. Ghost stayed dead, that's the arrangement. He was quiet, then put it back in if you need to. She heard the weight of that from a man who'd pulled it out twice. She came back with a cup of black coffee, a packet of peanut butter crackers from her own bag, and a quiet she'd practiced until it cost her nothing. She set the coffee beside the tray. He didn't reach for it, right away. He watched her restart the IV in his left arm, the needle placed so cleanly he didn't flinch. Then he picked up the coffee. The hall was bright and too loud when she walked back out. Jackie was at the desk, so was Chad. So was Dr. Holt, who had clearly been expecting her to emerge red-faced and defeated inside 10 minutes. He's stable? Holt said like he didn't believe it. He's talking. Right lower lung sounds diminished, abdomen rigid on the right with point tenderness, temperature climbing. I need imaging ordered. CT, abdomen and chest. Holt's expression settled into the particular patient's doctor's reserve, for people they consider beneath explaining things to. He's septic from the IV sites, Laine. We've seen it before with patients who keep pulling their access. We treat the infection. The location of the tenderness doesn't fit an IV site infection. I've been practicing medicine for 19 years. Audrey kept her face neutral. She'd learned that in a much harder school than nursing. Then the imaging will confirm what you already know, she said, and we can move forward. Chad snorted from the wall. She's ordering you around, Pete. Holt's eyes went flat. Laine, you're 22 days into your probationary period. I'd remind you of the difference between a clinical observation and a physician directive. She looked at him for one beat, long enough for him to know she'd heard him, then said, his pulse is 118 and his temperature is rising. The window on acute appendicitis isn't long. The word hung in the air. Jackie looked up from the desk for the first time. That's a significant diagnosis, Holt said carefully. Yes, Audrey agreed, it is. He has no appendix-specific complaint. He hasn't spoken to any of you in 6 days. He told me where it hurt because I asked him where it hurt instead of asking him to calm down. The hallway went quiet in the way that meant everyone in it was pretending not to listen. Holt tapped his tablet against his palm. I'll order an ultrasound, it's faster. Ultrasound will miss a retrocecal appendix on a patient with his body habitus, CT with contrast. His face said many things, none of them kind. Fine, document the request as nursing concern, not clinical directive. Back in room 7, she told Dale the imaging was coming. He's going to find a way to blame you if it's nothing, he said. I know. You're not worried? Not about that. She straightened the crackers on his tray. Eat something. Your blood sugar's probably low, and I need you to have some buffer if this moves fast. He picked up a cracker and looked at it. How long since you've eaten? 2 days, maybe 3. You're not going to lecture me about nutrition? You're a grown man who survived 3 combat deployments. You know what food is for. You stopped eating because you didn't feel safe, not because you forgot how. She met his eye. When people feel safe, they eat. He was quiet a long time. Ghazni, 2011, he said. I lost 2 men in that valley before the medical element came through. We found out later there was an operator who called a medevac command had already denied. She rerouted it through a civilian aviation frequency. Got our people out. The official report said the medevac was authorized. I always knew it wasn't. Nobody ever told us her name. Audrey said nothing. The ultrasound tech arrived. Audrey stayed, positioned where Dale could see her face. When the probe pressed his right lower quadrant, his breath went short and sharp. The tech looked at the screen, then at his phone. Dr. Cross, I need you to look at something in room 7. Dr. Renata Cross arrived in 6 minutes. Compact, deliberate, the kind of energy that had already assessed the situation before she cleared the doorway. She looked at the image, then at Dale, then at Audrey. Who flagged this? Audrey raised her hand. Good eye. Cross turned to the tech. Call Orr, tell them we're coming. She looked at Holt, who'd materialized in the doorway. Perforated appendix with periappendicitis. He needs surgery now. Whatever workup you had pending is on hold. I ordered the ultrasound, Holt said. Who diagnosed it? Nobody answered. Dale looked at Holt from the bed, his voice very even. She did, the nurse. Told me 20 minutes ago. Holt's face worked through several expressions and landed on none of them cleanly. Cross turned to Audrey. Walk me through the assessment. Audrey did, right lower quadrant rigidity, point tenderness, fever climbing, tachycardia timeline. Cross nodded once, good, to the Orr nurse behind her, let's move. Audrey reached for the bed rail, may I? Dale nodded. She raised it, checked the IV, made sure the fluid ran clean. His hand covered hers for 1 second. Not grasping, just there, the way people said thank you when words were too many. They took him to surgery. Jackie was very quiet at the desk when Audrey came back out. Chad had stopped leaning against the wall. Holt was in the physician workroom with the door most of the way closed. Audrey documented everything, every assessment finding, every request for imaging, every response she'd gotten. Facts didn't argue, they just sat in the record and waited. Dr. Cross came back 2 hours later, found it during surgery, perforated, another few hours and we'd be having a different conversation. She stopped at the station and looked at Holt. She called it on assessment, without imaging. I made the clinical decision based on available information. You ordered an ultrasound 20 minutes after she asked for CT. I used clinical judgment. Cross set the surgical report on the desk. He'd have been in septic shock by morning, no heat in it, just fact. She looked at Audrey. Nice work. 2 words. They landed heavier than any insult had. Audrey looked at the linoleum for a second and felt an old memory rise. A field hospital, a night, a man whose blood she couldn't stop fast enough, a commanding officer who'd said wait for confirmation, and by the time confirmation came, the question had already answered itself. She pushed it back down. Dale needed present tense care, not her ghosts. Jackie said, how did you know? I asked him where it hurt. Jackie didn't say anything else. That evening, 2 things happened that Audrey didn't expect. The first, a security officer she'd never seen came to the station and asked for her by name. Broad man, dark uniform jacket, badge turned backward, shoes too clean for someone who'd been on shift. She noticed the shoes first, old habit. Can I help you? Dr. Holt asked me to pull some incident documentation from records. Said you could sign off on the access request. I can't sign off on record access, that goes through administration. He smiled, the wrong kind of smile for a routine question. Can I get your name? He gave her one she didn't recognize from the security roster she'd memorized her first week, because she memorized things like that. She waited until he stepped away from the counter, then called the head of security directly. 3 minutes later, the real team was at the station. The man was gone. They found him in the records room, Holt's badge code on the keypad. He'd pulled 2 files, Dale Souza's, and one other. A name Audrey recognized from a different life entirely. The second thing happened when Dale came back from recovery, groggy and pale. Ghost, he said when he saw her. You're out of surgery. Everything went well. They came for the file. He looked at his hands, a man deciding whether to put something heavy down. Before I collapsed at PT, someone was in my apartment. My service record, deployment reports. I kept copies. I knew someday someone would try to bury them again. What's in the file? Holt signed medical clearances for 3 contractors in 2019. All 3 had disqualifying conditions. All 3 deployed to a security detail in a theater where those conditions directly contributed to a mass casualty incident. 7 dead. The report blamed equipment failure. The room went quiet in a particular way. Where are the copies now? My prosthetic case, the one I bring to appointments, there's a false bottom built into it. I didn't think I'd be gone long enough for it to matter. I left it at PT in the cabinet. She picked up the phone and called PT before the man in the wrong shoes had another 20 minutes to work with. The case was still there. Real security brought it back intact. "You're not just a nurse," Dale said. "You need sleep, you just had surgery." The Ghazni medevac, was that you? 7 people in my unit came home because someone made an unauthorized call on a civilian frequency and then disappeared from every record we could find. She straightened his blanket. "Get some rest. I'll be back at the next vital check." She left before he could say anything else. The security supervisor met her in the hall. "This is bigger than the hospital. We need to call federal authorities about what he had in that case." "I know." "How did you know to check his badge?" "Old habit." Director Francis Whitmore called an emergency meeting at 6 a.m. Audrey, Holt, Jackie, Chad, and the security chief sat around a conference table under framed words like integrity and surface in institutional fonts. Audrey had noticed a long time ago that organizations which actually lived those words rarely needed to frame them. "We have a serious situation," Whitmore said. "A man was caught attempting unauthorized medical record access using a falsified credential. We're conducting a review." "He was targeting Dale Souza's records," Audrey said. "That's one component. He was sent by someone with access to the badge code system." Whitmore looked at Holt. Holt looked at the table. "Dr. Holt's code was used on the keypad," the security chief said. "I did not authorize that." "Someone did. I lost my badge 2 days ago, I reported it." The chief pulled a form from a folder. "The lost badge report was filed this morning, at 5:47 a.m., 2 hours after the incident." The room went very still. "This is circumstantial," Holt said. "His badge code opened a door," Audrey said. "His name was on the access request. His files were the ones the intruder asked me to authorize. And he was the one who delayed imaging on Dale Souza by 20 minutes when acute appendicitis was the presenting complaint. You're a probationary nurse with no standing to make these accusations." "You're right that I'm probationary. But the documentation is in the record. Every time I asked, every response I got, the delay, the outcome." "Laine," Whitmore said, "are you alleging Dr. Holt intentionally delayed care for this patient?" Audrey chose her words. "I'm saying the record shows what happened. I'd encourage you to read it carefully before deciding what it alleges." Holt pushed back from the table. "This is absurd. She's a new hire with a chip on her shoulder who got lucky on one clinical call." Dr. Cross walked in without knocking. She'd clearly been standing outside long enough to hear. "She didn't get lucky. She assessed a nonverbal patient correctly in under 15 minutes when 3 staff had already given up after 6 days. She caught a perforation before it became a fatality. She flagged unauthorized access to federal medical records before your own people found it." She looked at Holt with something in the neighborhood of contempt. "Lucky isn't the word I'd use." "Elise." "Sit down, Peter." He sat. The door opened again. Dale Souza stood in the doorway in a hospital gown, one arm across his abdomen, his eye moving around the room the same way it had moved around his own, mapping exits, measuring threats. A night shift nurse hovered behind him, deeply unhappy. "He should not be walking," she said. Audrey was already on her feet. "You need to be in bed." "I'll go back, not before I say this." He looked at Whitmore, then Holt, then Jackie and Chad, who'd stayed small in their chairs. His voice was rough with anesthesia and 20 years of hard use. "I want this on record. This nurse came into my room when 3 staff had already quit on me. She didn't touch me without asking. She didn't talk to me like a problem to be managed. She asked what I'd actually eat, and she got it for me. She caught what your doctor missed. And she was right. And she had to fight 20 minutes for imaging that should have been ordered on site." His eye moved to Holt. "You delayed care on a veteran because he was difficult. Difficult means you hadn't found the right key yet. She found it in 15 minutes. You don't know the full clinical picture." "I know my own body. I've known it 30 years longer than you've been a doctor. When she pushed on my side, I told her it hurt and where. Nobody had asked." The room had no answer for that. Dale steadied himself on the doorframe. "Whatever she did before this job, whatever name she went by, she came in here and did the job right. That should be enough." His eye moved to Audrey. "But it's not the whole story, and I think you know it's time. You need to sit down. Tell them." She looked at the table, at Whitmore, pen stopped midline, at Cross, arms at her sides, at Jackie, looking at her hands. "My full name is Audrey Mae Laine. I hold an RN license in this state. Before that, I held a 68 WMOS in the United States Army, Special Forces Medical Sergeant, attached to a Special Operations Task Force element. 3 deployments over 8 years. Medically separated in 2018 under a sealed record. My call sign was Ghost." The conference room didn't move. Holt broke first. "You're not a combat medic, you're a nurse." "I am a nurse. I was also a combat medic. Both are true." "Why is your record sealed?" Whitmore asked. Because the testimony I was asked to give was inconvenient for people with contractors and careers to protect. She glanced at the security chief's folder, the same people whose names are probably in Dale Souza's file. The chief opened the folder and turned it toward Whitmore. The name Peter Holt appeared on 3 contractor medical clearances dated 2019. Whitmore looked at it for a long time. Those clearances were processed through proper channels, Holt said. 3 of those contractors were deployed, Audrey said. 2 had untreated traumatic brain injuries. 1 had a cardiac condition that contraindicated high-altitude operations. All 3 conditions became acute during the same operation. 7 people died. How do you know about this? She met his eyes, because I was the medic on the ground. The quiet that followed was the kind that happens when something large shifts underneath a conversation. You can't prove intent, Holt said, quieter now. The documentation exists, the security chief said. Clearance forms, deployment records from the evidence case. Those are sealed files. They were unsealed the moment the man you sent into this building tried to steal them. Jackie made a sound that wasn't quite a word. Holt stood, reaching for his tablet, his hands not fully steady. Cross stepped into the doorway before he got there, didn't touch him, just stood there, and something about the way she stood made stopping seem like the only option. He sat back down. Federal investigators arrived by noon, called by the security chief before the meeting even ended. They took Holt's badge at the door, took Chad's statement, took the folder, and sealed Dale's room as a protected witness situation with 2 officers posted outside. Within the week, Holt was placed on administrative leave pending a formal Inspector General inquiry into the 2019 clearances, the last anyone at Hargrove heard of him. Jackie found Audrey in the medication room at 1 p.m. She stood in the doorway a moment, then said, I gave you that chart because I thought it would embarrass you. I know. Why didn't you say anything? About which part? Any of it, your background, what you knew. You could have shut us down on day 1. If I'd told you I was a Special Forces medic on day 1, you'd have treated me like a story. I wanted to be treated like a nurse. Jackie looked at the floor. That doesn't make what I did okay. No, it doesn't. I've worked here 11 years. I know how hard this place is on veterans. I know how often they come in and don't get what they need. And I still handed a man who hadn't spoken in 6 days to a new hire as a joke. Audrey set down the medication tray, then use it. Use the guilt. Don't perform it for me. Use it in that room next week with the next patient nobody wants to deal with. Use it when a resident wants to document anxiety before he's ruled out something physical. Use it when someone laughs at the station about a difficult enigma. She picked the tray back up. That's what it's for. Jackie didn't cry, but she looked like she'd needed someone to tell her that for a long time. Dale Souza went home 18 days later, walking out under his own power, ahead of schedule, his surgeon said, which Dale said was not a surprise to him. He stopped at the station on the way out and signed something to Audrey in a language that wasn't ASL. She signed back in the same one. What is that? Chad asked. Thank you, Audrey said. And you're welcome. Dale looked around the station, at Jackie watching him, at Chad watching Audrey. I want to say one more thing before I leave, not for her. She doesn't need me to say anything, for me. He spoke to the room. She didn't save my life because she knew my record. She saved it because she asked me where it hurt, and she listened to the answer. He picked up his bag. That's the whole thing. That's the whole job. You either do it or you don't. He walked out. The administrator convened a policy review the following week, chaired by Dr. Cross. Whitmore sat at the far end of the table and said very little. By the end of the month, Hargrove VA had 3 new directives. First, any patient who'd gone more than 48 hours without substantive verbal communication would get a mandatory secondary assessment by a senior nurse before the attending's plan of care was finalized. Second, the word non-compliant in a chart would require documented evidence of what communication methods had actually been attempted. Third, no staff member could request reassignment from a difficult patient without a documented conversation about why the patient was considered difficult and what alternatives had been tried. None of the directives mentioned Audrey's name. She'd asked for that specifically. 3 weeks after Dale's discharge, she found a note in her locker. One line, handwritten on a sheet of army stationery she recognized from a different era. The medevac in Ghazni, I knew it was you. Thank you for staying Dale enough to stay alive. Souza. She read it once, folded it, and put it in her badge holder. Then she went back to the station. There was a new admission, a woman, 67, blind in both eyes since a vehicle accident 18 months prior, admitted for a respiratory infection, listed on the intake form as uncooperative and difficult to assess. Audrey picked up the chart. She walked to the room, knocked twice, soft but deliberate, and kept her hands where they could be heard. My name is Audrey, I'm your nurse, tell me where it hurts. And she listened to the answer.